When I was about 8 years old, I had an injury to my spine, and I actually was playing with a friend and was pushed off of a retaining wall at school and fell flat on my back. And what happened that I didn't know happened until years later was I actually fractured my lumbar spine in two places. And it caused some problems for me. It was kind of I had some back pain and I had some things, but as a kid, you can shake those things off and keep going. And that's what I did. My parents knew that I had had this injury, and I seemed to kind of get along okay. But as I got a little bit older, the pain continued. And so I wanted to, find options to continue to play sports and things. Running, playing soccer was difficult for me. And so we'd been to the pediatrician. They checked my spine a little bit, but honestly, they just never did a very good job of evaluating what was going on with me. And so we tried different pediatricians, we tried some chiropractors, and nobody ever really took that injury seriously. In fact, most of them tried to convince my parents that I was making up the injury because they couldn't figure out what it was, which was really frustrating. We finally went to a different chiropractor, and the first thing she did was take an x-ray. And now looking back at that, I can't believe that nobody ever took an x-ray of my back with that history until about 8 years later. And the first thing she said when she came back in the room was, "When did you fracture your spine?" And she showed me on the x-ray where it had been fractured and healed, and we created a plan to sort of work on that. The problem was that I noticed that I felt better when I got chiropractic care, when I got adjusted, but it didn't last forever. And so I needed to keep going back, which was sort of frustrating for me as a kid. And I wanted an option to fix the problem permanently. And so we decided to talk to orthopedic surgeons, spinal surgeons, and see what other options existed for that. And so when we went to these different specialists, they had different ideas of what they could do. There were basically two thoughts on it. One was have surgery now. Have surgery while you're young because you'll heal faster and you'll never have to worry about it again. And the other school of thought was do not have surgery until chiropractic is no longer working for you. If you are still enjoying life, you're still getting around, you're still doing the things that you love, then don't do anything surgically because you can't go back from that. And it was frustrating to me trying to decide what I should do. Should I go with route A or route B, surgery or no surgery, stick with chiropractic or try and fix this thing? And honestly, as a kid, I thought surgery would be pretty appealing. I wanted to have that done and never have to worry about any other back issues in the future. And so I discussed that with one of the surgeons, and he sat me down and he showed me exactly what was going on with my back. He showed me his anatomy textbook. He showed me where the spinal cord is and the nerves, and he talked to me about the real, possibility of this being worse and being, in a wheelchair and all kinds of things that could happen if the surgery didn't go perfectly. And so he convinced me that sticking with chiropractic care, because it was already helping me, until it no longer helped me was the right thing to do. And that's what I decided. And it changed my life in multiple ways. One, I'm very healthy now and I can do all the things that I want, but also I became a chiropractor. But that process really taught me something. It taught me that it gave me a vision, I should say, that if I could get multiple people in the same room and talk about that condition and kind of work out the details and talk about the pros and cons so that I could make a good decision on what I wanted to do, that would be the ideal. And that didn't really exist. I couldn't find a practice that kind of had different practitioners, physical therapy, chiropractic, maybe the medical side, surgeons, orthopedists, and figure out what the best care would be and come up with a plan together as they talk about their different specialties. And that's what I wanted to create. And that's what we did at Restorative Spine and Joint.